Hi there. Welcome to this lesson on the musculoskeletal anatomy of the trunk. In this series of six short videos and short videos to kind of allow you to break the information down and digest a little bit better, um, these videos will teach you about the bones, muscles, and nerves, and as well the skin of the trunk. I'd like to start this lesson by talking about the basic design of the vertebrate body. Uh, our bodies, as well as any vertebrate body, is broken into three main regions, three main parts. Of course, we have the head, which we'll talk all about later this semester. We have the trunk, which we're focusing on today in this series of videos. And then the appendages, of course, which attach to the trunk. Now, our trunk is divided into segments that are called somites. And so if we take a look at this developing embryo here, we can see that there are these little lines over here by the spine. Uh, each one of these is a segment or a somite. And so if we take a section through the embryo, we take a look, uh, just for a little bit of orientation here, this is developing into your spinal cord, you're part of your central nervous system. This is your developing gut tubes. This will be your digestive system. Here is some space surrounded, and then this all the way around the outside is your body wall. Of course, in future lessons, you'll learn all about the viscera, so the internal organs. For now, we're just focusing on the musculoskeletal system. And so what I want you to see is that there are a series of stem cells within the body wall that differentiate into bone tissue, they differentiate into, or sorry, they differentiate into muscle tissue, they differentiate into nervous tissue, and they migrate out from essentially this space here on the dorsal side near the spinal cord. They migrate out in all directions. And this is happening in every single one of these somites. And so every single region, same pattern, just happens over and over again. And so this is the substrate from which we build our muscles and our nerves. And of course, our bones can be built within these preliminary structures as well. And so within a few weeks, we have this underlying structure. We have some nerves that are passing out, closely associated with several layers of muscle tissue. So each one of these little lines here is a layer of muscle tissue. And of course, we're going to learn the names of all of those. And creating this network within every single repeating segment. Okay, so these migrating cells develop into all of the structures that we're going to talk about today. And so you might be thinking, why do I care what is she bringing this up for? Well, each segment develops in the same exact pattern. So instead of memorizing, these structures within this segment and these structures within that segment and like memorizing, instead we can learn the general pattern and then apply that pattern, at least look for that pattern all throughout the torso and even beyond a little bit later this semester. Okay. Any differences that we see from segment to segment has some sort of a functional story associated with it. So any kind of structural modifications enable functional differences. So you might imagine that the thoracic segments might behave a little bit differently than the lumbar segments might. Okay, so I bring this up so that you can look for the pattern, so that you can reduce your cognitive load. You can learn the pattern once and then apply it to all of the different segments. Okay. And so these segments are named. Okay. We've already talked about this a little bit in class, but the vertebrae are named according to their region, as well as the number within that region. Okay, so for example, the vertebrae we know are named according to the cervical, thoracic, lumbar, sacral, and coccygeal regions. Okay, so the first attribute of their name is the letter C, T, L, S, or C. Okay, as we know, there are 7 vertebrae within the cervical spine, 12 in the thoracic, and 5 in the lumbar, and so the vertebrae are named accordingly. Okay. Also, in addition to the vertebrae having this letter number designation, the spinal nerves have a similar name. Okay? As we know, spinal nerves exit from the vertebral column or the vertebral canal through these intervertebral foramina. Right? So these holes in between each vertebrae, each pair of vertebrae. The spinal nerves are named according to the adjacent vertebra. So in the cervical spine, the spinal nerves, for the most part, exit superiorly to their associated vertebra. So for example, this here is C1. Remember that C1 is called Atlas, right? Holds the world, holds our head on our shoulders. Okay, so spinal nerve C1 exits right above Atlas or C1, the vertebra. Okay. Spinal nerve C2 exits above vertebra C2. Spinal nerve C3 exits above vertebra C3, okay? And so on and so forth all the way down. However, there is one exception to this. There are, in fact, 8 spinal nerves in the cervical region, and there are 7 vertebrae within the cervical region. And so spinal nerves C1 all the way down to C7 exit above their similarly named vertebra. So C1 is over C1, C2 is over C2. But the 8th cervical spinal nerve exits inferior to its to C7. And so spinal nerve C8 exits inferior to vertebra C7. Okay, so you should be prepared to identify which spinal nerve and which vertebra. Okay. In the thoracic region, we of course have 12 vertebrae, right? Each vertebra articulates with a pair of ribs. Okay, so these thoracic vertebrae have associated thoracic spinal nerves. Okay, all of these spinal nerves are named according to whatever vertebra is above it. Okay, so vertebra T1, spinal nerve T1 is underneath it. Vertebra T2, spinal nerve T2 is underneath it. Okay. In the lumbar, again, there are 5 vertebrae, 5 spinal nerves. Again, they exit underneath or inferiorly to the vertebra for which they are named. Okay. Finally, the sacral or sacral. Remember that this bone is actually 4 to 5 vertebrae that have fused together over time. And so they have 5 spinal nerves as well. And so these are named according to, which number in line, right? So S1, S2, S3, etc. Okay. And so each one of these spinal nerves, as we know, exits from the spinal cord and is going to pass through an associated region of this particular segment. And we'll come back to that. Okay. Okay. So each segment, right, each of these somites develops a vertebra with a specific name, a spinal nerve with essentially the same name, and that spinal nerve is going to innervate not only the muscles, but the skin of that particular region. And so each essentially strip of skin that is innervated, that is controlled by, right, sensing and giving motor commands by a specific spinal nerve is called a dermatome, right? Derma for skin. Okay, so these are skin regions, skin strips that are innervated, controlled by sensing an individual spinal nerve. And so what you can see is spinal nerve C4 innervates all of this, right? So if you're in a car accident and spinal nerve C4 is severed, and so it can't send messages, it can't receive messages, you would lose feeling and control over this particular region of skin, okay? This stripe right here is innervated by spinal nerve T7, and so on and so forth, all the way around the body. Note that the face is not controlled by spinal nerves. Okay, so it's not innervated by spinal nerves. Instead, it's innervated by cranial nerves, and we'll get into that when we talk about the head as a region. Okay. Any kind of damage to a spinal nerve can result in negative outcomes in a particular dermatome. Okay, so any kind of infection, any kind of physical damage to the spinal nerve, again, loss of feeling, loss of control over that particular strip. And so in this way, we can localize, right? We can understand where an infection is, where the damage is, just by which dermatome is impacted. Great example of this is the shingles virus, right? So shingles is a type of herpes virus that infects the dorsal roots of spinal nerves. Remember that the dorsal roots carry sensory information only, not motor information. So these infections will impact the sensation of a particular dermatome, right, depending on which spinal nerve is impacted. The physical symptoms of a particular dermatome being infected is, of course, the characteristic rash, the shingles rash of this viral infection. We can see that this rash is not distributed equally over this man's torso. Instead, it is just in this little strip right here. So maybe this is an infection of T9, right? On the right side, T9 is infected. Okay, so that's the end of this video. Thank you for watching. Stay tuned for the next segment.